Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me as always is...
Maddie Norton.
Maddie, it's June. We're starting off a new month.
We are. Happy June.
Happy June. And before we get to our theme for the month, I also want to wish a happy Pride Month to all those who celebrate. We at AFSPA value the diverse group of people who make up our membership, our workforce, the wider federal workforce, and honestly, humanity as a whole. And we celebrate all those who observe this month in whatever way they observe it, and we wish you the best.
Absolutely. Happy Pride.
And we've got some episodes in our archive where we've looked at we've actually focused on Pride in June's past, and so we encourage people to go back and listen to those. But this month we've got a little bit of a different theme. Maddie, what is that?
Our theme for this month is men's health.
All right. And we're going to get into that. We've got a great episode focused on that, but that's not the only thing we're doing this month. So we've got some other things on the calendar.
Absolutely. And to start off this month, we will have this episode, which is we are filming on June 1st, but it'll come out June 8th. And then June 9th on a Tuesday, we have Maven Clinic doing a webinar called Men's Fertility, What You Need to Know for Growing Your Family. And that is at 6 p.m. Eastern Standard Time for an hour. So if you want to learn more about how your fertility matters, and especially when you're trying to grow your family and how best to support your partner in that, definitely sign up for that. It is free, and you can join and ask all of your questions. So look for that. It's all on aspa.org/events. On June 23rd, a Tuesday, Prudential is doing a Roadmap to Retirement webinar, and that's offered at 8 a.m., 1 p.m., and 6 p.m. Eastern Standard Time. So sign up for that if you are wanting to know more all about retirement and how to plan for it. And then on the 30th, we have a financial wellness checkup with Prudential. I believe all of those spots are full, but keep an eye out to see if any of them open up so that you can get a scheduled spot, and check out our emails that we send every month so that you can be the first to sign up and make sure you get a slot. And then always we have AFSPA Live on the last Thursday of the month at 11 a.m. Eastern Time. And this month it's on June 25th, and we will be discussing men's health. So
Absolutely.
If you have questions after leaving this podcast, save them and you can submit them and we'll answer them live.
Absolutely. And we'll have another podcast. We're planning on having another podcast later this month about some virtual care options that FSBP members can take advantage of, specifically focused on men's health, but open to others. And the same will be true as we discuss during AFSPA Live later this month. But it is National Men's Health Month, and I'm about to do an organic crossover, Maddie. So get ready for this. So
Okay.
I've been reading the book Elderhood by Louise Aronson, which is, by the way, our focus for our Senior Living Foundation's Next Chapter Conversations, a Quarterly Compass. We'll be talking more about that. We'll provide some information about that in the show notes if you're interested in topics around healthy aging. But in that, the doctor who wrote the book talks about her medical education, and that most of what she learned back in the early 90s was focused on Norm. Norm was a patient who was of an uncertain age, but generally in his 30s probably. He had an average weight and was typically Caucasian. And this was what most of their focus was on when they're talking about healthy patients. Occasionally they talked about Norma, who was a woman, and her main difference was that she was a woman
Right.
from Norm. But much of it was focused on men and how to treat men, and men of a very specific type, specific age, specific weight, etc., and background. That said, men's health, a focus on it, is needed by the general population because we've got I'm speaking to the Brotherhood now. We need to do better. Um, and just in that vein, yes, maybe doctors traditionally have been trained much to focus on what pathologies look like when they show up in men. But we're a diverse group. And guess what? We don't do such a good job taking care of ourselves, guys. Just a few statistics here. We are half as likely to see a doctor for a general checkup as women. We're also more likely to be uninsured than women. That's probably not as much of an issue for people listening to this podcast, but still worth noting. And we are dying at higher rates than women for 9 of the top 10 causes of death in the United States, which also means that our lifespan, which used to be fairly similar to women, is shorter, and that gap has increased to about 6 years. We are living 6 years shorter than women. And I just want to be clear also as we're discussing this and throughout our episode, when we say men and when we were talking about people who were assigned male and female at birth and specific health needs that people with that assignment may have. Not meant to be exclusionary, but I just want to provide that context as we get into discussing this. So we got to do better, guys. We got to take care of ourselves because when it gets into things like mental health, men are just based on what we see in Foreign Service Benefit Plan claims and particularly telehealth claims, I should say, we are women are twice as likely to seek care. 2/3 of those claims are coming in for women versus about 1/3 for men. So we've got to do better. We've got access to the same care, same information, and we're going to give you some more information today about risks and ways to mitigate those risks and also address some of the trends that we see in healthcare generally, but also in men specifically. Maddie, we've got a great guest to walk us through some of that today. Can you tell us who it is?
Yes, we have Dr. Kelly Ruel with us today. He is a family medicine physician, an Air Force flight surgeon, a CVS Aetna subject matter expert on men's health, and he is on the board of advisors for the Men's Health Network. And he has lots to share with us today. I do want to add, as we're coming off of May being Mental Health Awareness Month, that we talk a lot about physical health here, and we do talk a lot, or we do talk about mental health as well, but mental health is just as important as your physical
That's
health.
right.
And while you may think it might just involve counseling or taking medicine to help, it's not always that simple, which Dr. Rule hints on. But it can be, just changing mindset. It can be talking with people. It can be talking with your friends. And I think men really struggle to talk about hard issues with people that they're close with. And it's becoming more and more normal for people to do that. And I think men should know that when you're taking care of your mental health, you're taking better care of yourself, obviously, but you're also being a better person for your spouse, for your family, for your friends. And I just really wanted to reiterate that as we
Yeah,
start this episode. So we're so excited to learn from Dr. Rule, and I can't wait.
let's go. Thank you, Maddie. Dr. Rule, thanks so much for joining us again for AFSPA Talks.
Thank you for having me. It's great to be here.
Well, I know you've been with us in times past on a number of topics, including men's health. And since it is June and we're focused on that, and let's just dig in right away. Why do we
Sure.
need a month focused on men's health?
Well, it's been an interesting evolution in time of both men's health and women's health topics, and men have traditionally not had quite as much attention, I think, within the healthcare world and within I guess general media. But men's health, there's been quite a bit of a gap in several areas with men's health. And this month is meant to raise awareness for that. So their men have a higher risk for an incidence of cancer. And, as you probably heard in the media, there's a shorter lifespan in men than in women. And this is a gap that's been growing over time. In the past, the lifespan was similar, and due to a lot of factors related to environment and activities, there's been a growing gap up to 6 years now, shorter lifespan in men than women. Men traditionally have not sought out healthcare as often as women, And so that's been another issue for later detection of illness. And in general, all these factors kind of pool together to be a reason to have a month to kind of focus on it, a month and a week. And it's a month around Father's Day. So there's a lot of reasons to choose June. So a lot of reasons to think about men's health. And I think also the time is right now. A lot of people are growing in their awareness. The
Hmm.
internet is available with a lot more information. There's a lot more targeting, I think, of men's products and men's health in general and men's health clinics popping up. So there's a lot going on right now that's making this more relevant than ever.
And we're going to get to some of those men's health clinics and some of the stuff on the internet in just a little
Hmm.
bit. I look
Hmm.
forward to digging in.
Sure.
And just so that we can make sure all of our male members are, hopefully living as long as possible, what should they be doing on an annual basis for their health?
Hmm. Of course, that depends on the age, and it varies widely according to age. But I think the first thing that everyone should do is have a regular doctor that they go to, and they should see that doctor on a regular basis. Now, the ideal is a primary care doctor once a year. There can be a little bit variation in which specialist you choose. I'm a family medicine doctor, so I like family medicine. But you can kind of pick your specialty. Family medicine or internal medicine are usually very good to start with if you don't have a doctor, and go. The recommendation is annually if you can, to get checked out. So when you have that meeting with your doctor, you may or may not be old enough to hit some of the screening tests, which start later in life, but it gives you a chance to touch base, have a relationship with a doctor, and work together in the future when issues come up, and deal with a lot of basics that can be important at any age. So, you start with the screening tests with weight and height and blood pressure and some basic lab tests. And you can do that at pretty much any age. And then as you hit different age points, you can do other screening tests. And common issues with men, as far as screening and what to check on, involve heart disease. That's the most serious and high risk health concern for men. And so that's just a matter of basics: healthy diet, exercise, and screening tests that are in blood tests. So cholesterol, for example, basic screening tests, and blood pressure checks. So, and then once you get beyond that, you look at some of the more specialized cancer-related tests. In men, colon cancer and lung cancer are the tops. And colon cancer, you start usually around 55 now. The age has come down with the higher incidence of colon cancer earlier. And then it goes up to about 75 years old, and you can consider doing it later depending on your risk factors, and you can consider doing it earlier depending on your risk factors. Then there's lung cancer, for those who smoke or who have smoked in the past 15 years, and you can do that anywhere from 50 to 80 years old. And then there's prostate cancer screening, which is recommended around 50 to 69 years old. And we can talk in more detail on any of these. Prostate cancer is a little more complicated because it's not recommended for all men. But if you do get tested, it's 55 to 69 or earlier if you have some risk factors for prostate cancer. So those are some of the most important ones. There's other screening checks depending on your family history, and skin tests for skin cancer, and a variety of checks. And that's what you'll work through when you see your doctor. That's why those annual visits are so important.
And I'll just use myself as an example. I had my annual exam recently. We're recording this on June 1st. I went just a couple weeks ago, had my annual exam. Um, Turning 40 later this year, so I asked my doctor about what screenings I need to be considering. I've been referred for a skin cancer check, but that's based on family history. Um, I already have an endocrinologist for diabetes management and a nephrologist and a hepatologist for some other concerns I have. But you've reviewed it. Sounds like I'm not quite ready for colorectal screening as a preventive exam. I think PSA screening starts a little bit later, and some of those others. We're watching heart disease based on family history and so forth. But I guess I'm just wondering when we get to those, we're talking about colorectal and PSA screening sort of being widespread and something that starts at a specific age. Like, what are we talking about there? Are we saying absolutely a colonoscopy, or is something like a Cologuard home test sufficient to start with? And same with the PSA screening. I don't think we typically have in-office visits exams anymore, but it's more of a blood test these days. I wonder if you could just talk a little bit more. I think some men are maybe a little hesitant about going full, people generally, but going full on for a colonoscopy and even for a in-person prostate check. But some of that's changed, and so I'm just wondering if you can talk about different ways people can undergo those screenings.
You hit on some good points there, and that's one of the reasons men don't go for their exams is they don't want to get into those situations where they have any uncomfortable moments, and it's simpler just to avoid that. Nowadays, though, fortunately, we've gotten a lot better at what we call non-invasive tests or tests that don't involve going inside of you or causing any uncomfortable examinations. So, for colon cancer, for example, the gold standard is still a colonoscopy. The good
Okay.
news is it's only once every 10 years, and it's really not an issue at all. Those of us who have done it
Hmm.
know it's very quick, and you don't usually have any realization of what happened when it's done. And again, you don't do it for 10 years after that. But there are a lot of other, as you mentioned, Cologuard and other non-invasive options, and those are becoming more and more common and more exact in their ability to diagnose cancer. So some of the tests they're mostly stool tests, and some of the tests are done once a year. Some are done every 3 years. It just depends on the type of test. The
Okay.
other thing that's growing in technology now is non-invasive imaging like MRI or CT scan to look
Yeah.
at the colon, and it's getting better and better at detecting small polyps and masses in the colon. And so that's still kind of a growing area, but that can be done as well every 1 to 5 years, depending on your risk status. That's still a little bit uncomfortable. You still have to clear out the colon, just like a colonoscopy, and inflate the colon with air usually to get a better view. So it's still not. It still has some similarities to colonoscopy, unlike these other stool tests, and blood tests are coming around, but they're still not as good usually as the colonoscopy or the stool testing. So colon cancer has a lot of options now. You don't have to go in for a colonoscopy. If you don't want a colonoscopy right away, then ask about these other options with your doctor. And that also just depends on your family history, though. If you have a risk for colon cancer in your family, or you've had abnormal polyps or other issues in the past, then usually the colonoscopy is the one that'll be recommended rather than these other tests
Okay.
because they're still not exactly as good as the colonoscopy at catching things.
Right.
And then prostate cancer is also the rectal exam is no longer necessary anymore. PSA is the best of the blood test for prostate, and so that's also a very easy test to get done. So you just have to decide with your doctor whether or not to do the PSA test, and the it just depends on the doctor and on the patient, I think, on how that's handled. The guidelines have shown that in a lot of cases, the cancer is so slow growing, and lots of times there's so many side effects from either doing further biopsies and testing and prostate removal that it's often not necessary or worth doing the PSA test. So that's a very individualized decision. If you're high risk, let's say you're Black or African American, or you have a family history of prostate cancer, then it's you're at higher risk for getting the cancer and in a more aggressive form. So you may want to consider the testing more seriously and start even earlier than 55. If you're not at high risk and you have no family history, you may want to just pass on the PSA. So, and now you can Google and research a little bit if you want to ahead of time and talk to your doctor about it, make that decision. But a
Okay.
lot of other tests like cholesterol and other things are all non-invasive now. Lung cancer screening is just there's a lot of imaging tests now basically to check for things. Ultrasound, CT scan for looking at potential pains or risks. Um, and there's not a lot of we're kind of limited on the number of screening cancer tests that we can do right now.
Sure.
But that's why I'm hitting a lot on prostate, lung, and colon. Those are the big ones in men right now.
Yeah.
So,
Okay. Thank you.
mhm.
Yeah. We've talked a lot about physical health, but what about mental health? Are there any specific concerns for men in that area? Perhaps particular diagnoses more regularly seen in men than women?
Mhm. There are a lot of things to think about in terms of mental health in men, and I'm happy that now more than ever people are starting to think about it more. be more open to getting evaluated for it and go for treatment. So I highly encourage all men to consider this as a part of their overall well-being, their overall health. And so the a lot of the conditions, of course, are similar between men and women, but they're often underdiagnosed in men, partly because men don't go and get checked, partly because men don't talk about some of these concerns. But I have noticed in the patient population now that there is more willingness to discuss it, and I think more screening being done. So, depression is a special concern of mine in men. It's underdiagnosed and compared to women, but men have similar amounts of depression if you actually do screening on that. And men are 4 times as likely to have a suicide risk. And so I think everything we can do to catch and diagnose depression early and work on it is important. And that the symptoms of depression are sadness and lack of energy and interest in doing things. And so if you feel like you're in that situation where you're feeling very sad, stress can sometimes be a part of it. You're feeling down, you feel like you're not doing what you usually do, you're not sleeping the same as you did, symptoms like that and signs like that, then it's good to consider getting checked out for that and to talk to someone about it. And so that can be your doctor if you have a relationship going with your doctor, or you can pick a new doctor. You can talk to a chaplain or a priest or a minister. You can call, there's a lot of hotlines, suicide hotlines, and telemedicine options depending on your interests and your plan. Telemedicine has been very popular now, and
Yeah.
telehealth with mental health care. So there's a lot of options now to get some both counseling and medication if needed. And the important thing is to speak up if you feel that you have some concerns. Talk to someone; they can kind of help work through it with you to figure out what's best to do for the treatment. Because the treatment's complicated. It can be sometimes just counseling or therapy is useful. Sometimes medication is useful. Sometimes making changes in your life is useful because there's a lot of factors involved in it. And mental health in men, I mean, involves a lot of other areas as well. And I mentioned stress already, but stress is a huge issue, and it's important to kind of, I think, stop once in a while, think about your life, think about where your stress level is, think about whether you need to make some changes in your life. Relationships are also an important factor in your mental health, and so it's sometimes good just to sit down and think, how are you doing with your relationships? And of course, everybody's got a very different life situation. Some people are single, some people have a spouse or partner or children, and I think sometimes you got to analyze your relationships a little when you're feeling down or stressed, and try to figure out ways that you might be able to make a difference. Analyze your career and your career path and your workload and your living location and financial situation. All these things can be a factor. But I'll say for sure, depression is one area to pay special focus. Anxiety is an area that a lot of men have issues with as well. PTSD in a lot of men who've been in the military or had firefighter or police occupations, because a lot of that is still more men than women in a lot of cases. That's a special area of focus. PTSD, post-traumatic stress disorder, as well.
Mhm.
So if you've had a traumatic event and you feel like it's getting you down or affecting you or causing you to react, that's another area to look at. So there's a lot of areas to think about in mental health.
Thank you. And we'll include some resources, both general availability and those available to FSBP members in the show notes for today's show. So if you are finding yourself needing some assistance, please take advantage of those resources when you notice that.
Yeah.
Dr. Ruel, I want to pivot a little bit because, like so many areas of life, men's health has its own trends. A term I learned recently is looks maxing. I think I may be a little behind on keeping up with this, but I also understand there are different forms of that, both soft maxing and hard maxing. I'm not going to get into some of the more extreme ways that people pursue looks maxing, trying to create the perfect image in their physical appearance, sometimes regardless of extreme ramifications to their physical or mental health. But I would like to explore a few of the more commonly and easily accessible elements that people are utilizing. So we're going to start with something very simple that I think a lot of that is in almost everything now, which is protein. What can you tell us what impact men or maybe just people in general, but obviously we're focused on men's health today, what men might see from taking protein supplements or even taking advantage of the drinks and foods that have added protein that seem to be everywhere these days.
Yeah, protein, of course, supplementation is everywhere. And just to give you a little background, proteins are kind of the building blocks of a lot of what we have in our body. So, the big talk is about muscles, but protein is in everything that we have. It's just groups of little, what we call little blocks of amino acids that come together and form another topic, which is peptides or proteins. And these can, like I say, do a lot in the body. The main talk, of course, for proteins is on building muscle mass and strength, and it does help to a certain extent, but it's a very small extent. So reality is that most men get enough protein in their regular diet that the actual supplements that they take on top of that really are excess. So, but there are some studies that if you do exercise, resistance exercise, weightlifting, other resistance forms, and I'm not speaking so much about aerobic exercise like
Hmm.
running, but if you do resistance exercising and you take protein supplements, it can help a little bit with both muscle mass and with strength. But like I say, it's been shown to be fairly slight, and the
Okay.
supplements usually are just a slight increase, if anything, over what most people already get as far as the max, because your body can only use a certain maximum amount of protein at a time. So it's as far as I guess recommendations on whether or not to use these protein supplements and thoughts on them, it's okay to try as long as you don't go with excessive amounts. And it's a little
Right.
detailed to talk about the exact amounts. That you can talk to your doctor or look online for total amounts. But there's a certain kind of factor of amount of grams per kilogram per day that you should take in, and so the total amount, so which is the total amount that you take in per day, like I say, is usually taken care of by a regular diet. So,
Okay.
and all of this factors into, like you said, to this looks maxing, which is related. Basically, it's not much different than what everyone has always wanted to do in the past, which is look better or look their best. And so part of it is nutrition, part of it is the more serious cosmetic surgeries and options. But there's you always have to balance that out. It's you don't want to overdo and put yourself at risk. Now the protein have major risk factors for doesn't have major risks for most people who use these protein supplements, but there is a subset of people who have kidney issues and or predisposition to kidney issues. And if you take too much protein in that case, you can cause some risk to your kidneys. So you want to be careful with the
Yeah.
supplements. The other issue is some of the supplements have quality issues and contaminant issues. So you want to try to choose something that has a higher quality and less risk of contamination, because these are not as well controlled as standard FDA
Yeah.
approved medications. So
Okay.
so it's something people can try. It doesn't make a big difference. I would say not to go overboard on it. There's a lot more talk about it than actual benefit.
All right. Something I know a lot of my guy friends use is creatine. What is the right amount to take for that? Is there a way to overdo it?
Hmm. Yeah, creatine is kind of used in a lot of ways for similar reasons to protein. Creatine is not a protein exactly, although it does have some amino acids in it, but it's a compound that's usually stored in your muscle, but it's also used in other parts of the body and other body functions. Also has an effect on both muscle mass and strength. Again, it's a small effect, but it can have a fair effect on strength if you are doing exercise, resistance training, so weightlifting, that type of a workout. If you don't do any exercise, both of these, the protein and the creatine, don't make a big difference on strength. And again, the you just have to be careful about the quality of the product that you're taking. Creatine, it's a little less complicated than the dosing for the protein. So 3 to 5 grams a day is kind of the standard supplement for creatine. So, and not to be confused with creatinine, which a lot of people talk
I
about as
made that
well.
mistake. Yep.
Yeah. It's common. Even I've heard people mix it up with collagen and other C supplements. But creatinine is a waste product. Creatine is this muscle compound.
Got it.
So,
What
mhm.
about peptides? Because there's a lot of talk about that from some of our political leaders and other health influencers and so forth. What are we talking about there?
Yeah, peptides are really just kind of forms of proteins or short proteins. They're just little groups of amino acids. Peptides have been talked about since the beginning with proteins. I mean, many years ago in school, we were studying peptides. They're just short proteins. So there's a lot of different types of peptides. Some medications have connections to peptides, like the GLP-1s, and there's some popular more aesthetic medicine or cosmetic medicine clinics out there now that are trying to push these peptides, and some are skincare products.
Yeah.
I, I can't say there's a lot of scientific or evidence-based medicine behind a lot of it. And a lot of proteins are just or peptides are just normal groups of amino acids that are similar to proteins that are already out in nature. And I would say it's kind of a trend, but for the most part, they're not anything that's got any significant gain if you actually
Okay.
look at some of the studies on it. So,
Okay.
but a popular trend. But
No, I
it's a popular
appreciate.
topic, but it's not really a unique or new topic. I think it's just the word is new to some individuals, so
Right.
it's
Okay.
taken
Well,
a little bit more popularity in the media.
and I appreciate having an actual doctor's take on this rather than
Mhm.
the ads I get on social media. And some of those ads, just one other piece, uh, given my age and stage in life, apparently I should be encountering a lot of medical issues and so forth. But I guess one of the solutions that is presented to me over and over again, to solve everything is testosterone therapy. And I
Mhm.
think this is becoming more, at least more discussed for men of all ages. So I guess what should people know about testosterone?
Yeah, that's a great question, and that's always one of the biggest topics in men's health. I think, and when you talk about talking to a physician about some of these things or a doctor, I think we do kind of have a different perspective on a lot of these options, and I think sometimes maybe modern medicine is a little bit too distrusting of some treatments. But I think it's a good thing because that keeps us cautious. So some of the other things we mentioned, like the proteins and the creatines and the peptides, a lot of it is there's limited evidence, and it's best to be safe and not take a chance and get too experimental with options. Because as you mentioned, there's a lot of trends and fads where people are pushing these things through marketing and advertisement. There's a lot of money behind it, and so there's not always a lot of real concern for your health or for something that works. So you have to be careful what you listen to and hear on the internet about these things. Now, testosterone is a little bit different because testosterone is a real hormone, kind of the men's hormone. And just like you'll hear about estrogen in women, you hear all about testosterone in men. It is kind of the fundamental hormone that affects men both sexually and with other parts of their system related to muscle strength and good blood cell counts and bone strength. Testosterone is a very important hormone, so it does have a lot of medical basis for concern. However, there is a huge trend now and unfortunately money is behind some of this,
Oh yeah.
but with men's clinics and with supplements for testosterone and with encouragement of the FDA approved medications for testosterone, there's a lot of overuse. So it's an important area of medicine to be cautious with. So the nice thing about it is, I think it's really very simple. So testosterone, if you actually lack testosterone, you can see it on a blood test. So the first step, if you're concerned about low testosterone, is you go to your doctor, you talk to your doctor about the symptoms that you're having or the signs or the reasons that you're concerned, and then the doctor can do a blood test And I mean, we can speak in numbers, but it's I don't want you to get too caught up in the numbers, but a normal testosterone is somewhere over 260 or 300 in the standard kind of US system. I'm not going to get into the units, but 260 to 300, that's normal. Most men are above that amount, and the issue is with testing. A lot of times, a lot of men's health clinics don't do proper testing. A lot of physicians who are kind of marketing testosterone, even physicians or non-physicians, they don't push a lot of these evidence-based guidelines that talk about doing tests for testosterone first before you initiate the medication or start the medicine. So a lot of symptoms that men think are related to testosterone are related to other causes, and age. Although, the average testosterone is maybe around 600 or so, especially earlier in life, although it can be higher or lower. But just to kind of give you an idea, average testosterone does kind of gradually decrease with time. But a lot of the studies show that a lot of the effects are not really that clinically significant, meaning usually it's something else and not the decreasing testosterone that's causing the symptoms. And of course, there's a lot of concerns related to muscle mass and sexual health and other areas, but only in the rare set of circumstances is it actually related to the testosterone being low. And that's why I say if you do the test and you see it's low, then you know it's a cause. And if you have any concerns, issues with sexual health, issues with you feel like decreasing muscle mass, or you find out there's anemia on your blood test, and hopefully your doctor will mention this. There's certain areas and conditions like that where it's good to get checked out as well. But outside of that, if your testosterone is not low, and I mean significantly low, sometimes it'll be a little borderline, and that's okay. And usually, if you repeat it, you'll find that it's not as low as you thought. So the other issue is it should always be done twice. So you never want to just do testosterone tests and then get started right away on testosterone without repeating it and double checking. But I think it's good to be cautious and not overtake. And there's a lot of other factors. I'll just mention, for example, that weight, other comorbidities, other medical conditions like diabetes and other conditions. Those all affect kind of testosterone and your body's response to testosterone quite a bit more than age. So I think this is one concern. A lot of men feel like as they get older, they need supplements of testosterone, and that's usually not the case. And if you look at all the supplements for testosterone, the FDA does not approve them for age-related testosterone. They're often not covered by insurance companies for age-related low testosterone. That's usually not the problem. And lots of times, for example, just losing weight a certain amount can make a big difference in symptoms that someone thinks are related to testosterone. So, but it's definitely a hot topic and an
Oh
important topic.
yeah. Yeah, and free testing from a lot of these clinics, right?
Yes,
They don't mention
yes.
two tests though. That yeah. So thank you.
Yeah.
All right. And if we do have someone listening today who maybe has not prioritized their health in recent years and is feeling inspired to take a step, what might they consider for that first step?
Yeah, it's you start with yourself and start easy, start with without going and doing anything. You should kind of take some time, think about where you're sitting and think about I know it sounds simple, but you want to think about your health. You want to think, what do you think you're doing or not doing? Have you gone to the doctor lately? Have you had any health checks lately? Are you careful with your diet? Are you careful with your exercise? Are you too stressed? Are you getting enough sleep? There's a lot of things you can kind of sit down and think to yourself, what am I doing or not doing correctly? And a lot of us already know based on what we hear in the media. So I think that's step one, is to take a little time out and think about that. Step two to me is find a doctor if you don't have one. And in this situation, I'm guessing, and a lot of men are in that situation, they don't have a regular doctor that they see. I would pick a family medicine doctor or an internal medicine doctor, set up an appointment and go. You don't have to know exactly what you're going to say, but just say you're there for a checkup, and that'll get the conversation going. If you think of anything that you're concerned about, you can bring it up. But those are the two main steps, and you can do it in person. You can try to do a visit over the phone if you don't want to go in person or you don't have time. A simple point to this is a lot of men, and I think myself included, we don't prioritize sometimes our health We kind of put it off. We're too busy, or it'll be fine, or we'll do it later. And the months can pass and the years can pass. And the next thing you know, you've turned a little problem into a big problem. So that's an important issue. So that would be my first thought for what to do if you need to get started.
I like it. And we'll include some information about the health risk assessment, our provider search tool, and some of those virtual options that are covered by Foreign Service Benefit Plan into
Mm-hmm.
the show notes for today's show. And Dr. Ruel, this has been a great conversation. I wish you could go on, but we want to keep people's attention on the podcast or the video. So before we wrap up, is there anything more you'd like to add?
There's a long list of things, and of course, like you say, we don't have a lot of time to go over them all. I just want to remind people, and I'll just kind of run through this real quick, and if there's anything you want to expand upon, we can. But make sure you're considering your vaccines. That's at all ages. You should be getting your vaccines taken care of. Make sure you're going to the dentist. Make sure you're getting your hearing checked. That's a big issue in older men getting their hearing checked. Sometimes they don't even realize they're having an issue. If you think you are, mention it to your doctor. Work on stress in relationships, like I mentioned. Think about the substance risk factors, the alcohol, the smoking, anything else, if that is in your life, and think about what you might want to do about that. Think about your risks for accidents. A lot of men are involved in higher risk activities, and they're not wearing their helmet, or they're doing it too often. Just keep that in mind. Make sure you're getting proper sleep. Make sure you're getting your eyes checked. So all those issues are important, especially the vaccines. I think there's more and more adult vaccines now, like tetanus and RSV and pneumonia and HPV and shingles. So all these things are important, and a lot of men don't go for their healthcare and they don't get their vaccines. And those are quick ways to improve their health.
I think that's great. We'll include again more information in the show notes about ways FSBP and AFSPA generally are there to support you in all of this. But Dr. Ruel, thank you so much for joining us. We appreciate your guidance always. It's often behind the scenes, but we thank you for making this opportunity to talk to our members directly.
That's been great talking to you. Thank you for highlighting men's health this month, especially.
Yes, sir. Thanks again to Dr. Ruel for joining us. Please check the show notes for today's episode for more of the resources discussed during this episode. And for information about preventive coverage and coverage for treatment and diagnosis under the Foreign Service Benefit Plan, please visit afspa.org/FSBP. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. The information offered in this podcast is meant to be educational. The views expressed by the hosts and guests do not necessarily represent AFSPA. Should there be any discrepancy between the information offered in this podcast and official plan documents for the Foreign Service Benefit Plan, or our other products offered by AFSPA and our partners, the policy provisions will prevail. Thanks for listening, and be sure to subscribe to AFSPA Talks on your favorite podcast app to catch all of our future episodes. Please rate and review us on your favorite app, and stay up to date on all things AFSPA on Facebook, Instagram, YouTube, and LinkedIn. Look for AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.